Let's continue with part 2 of chapter 10. After completing the initial parts of the primary assessment, EMTs may perform what is called a rapid exam. The purpose of the rapid exam is to quickly identify injuries or conditions that must be managed or protected before transporting the patient. This is especially important in a trauma patient where serious injuries may not be immediately obvious. A rapid exam is designed to be quick and efficient, typically taking about 60 to 90 seconds to complete. During this time, you are quickly scanning the body for any life-threatening problems that may require immediate intervention. It is important to understand that the rapid exam is not the same as a detailed physical exam. It is also not a fully systematic head-to-toe assessment. Instead, it is a brief, targeted scan to identify critical findings that could impact patient care or transport decisions. By performing a rapid exam, you can quickly identify major injuries and ensure the patient receives the appropriate care before being moved or transported. Another key purpose of the primary assessment is helping you determine the priority of patient care and treatment. Based on what you find during your assessment, you must decide how urgent the patient's condition is and how quickly they need to be transported to definitive care. Certain findings automatically place a patient into a high risk or high priority category. For example, patients who are unresponsive require immediate attention because this may indicate a serious neurologic, respiratory, or circulatory problem. Patients who are experiencing difficulty breathing are also high priority. Without adequate breathing, the body cannot deliver enough oxygen to vital organs. Similarly, patients with uncontrolled bleeding require immediate intervention and rapid transport because severe blood loss can become life-threatening. Recognizing these high-priority conditions early allows us to make appropriate decisions about treatment, resource use, and rapid transport to a medical facility. This slide continues with some additional considerations that may indicate high-priority patient. One of these is an altered level of consciousness. Changes in the patient's mental status can signal serious problems such as poor oxygenation, brain injury, stroke, or severe metabolic issues. Another high-priority finding is severe chest pain, which may indicate conditions like heart attack, pulmonary embolism, or other life-threatening cardiac problems. You should also be concerned if a patient has pale skin or other signs of poor perfusion. These findings may suggest that the circulatory system is not effectively delivering oxygenated blood to the body. Complicated childbirth is another high priority because the mother and the baby both may be at risk and may require rapid transport to a medical facility. And finally, severe pain in the body. This should not be ignored. It can be an indicator of a serious underlying injury or illness and should prompt a careful evaluation and appropriate transport decision. Another important concept when determining patient priority and transport is the golden hour, or sometimes called the golden period. The golden hour refers to the critical time between when an injury occurs and when the patient receives definitive care, such as surgery or advanced hospital treatments. During this time, early recognition and treatment of conditions like shock and traumatic injuries are super important. Prompt care during this window can significantly improve the patient's chance of survival and recovery. As EMTs, our role in the golden hour is to rapidly assess the patient, manage the life threats, and transport them to the appropriate facility. In many cases, the patient may require transport and treatments that cannot be provided in the pre-hospital setting, which is why rapid transport is one of the most important factors in patient survival. Understanding the golden hour helps guide our decisions and remind us that time is a critical factor in trauma care. This slide illustrates that golden hour and how time is divided during a traumatic emergency. The golden hour is that first hour after a serious injury, when rapid assessment, treatment, and transport have the greatest impact on the patient's survival. The process begins with the discovery of the incident and activation of EMS. Once EMS is notified, responders are dispatched and begin traveling to the scene. Within this hour, EMTs aim to follow what is often called the Platinum 10 minutes. This refers to the goal of completing the initial assessment, life-saving interventions, and patient packaging within about 10 minutes of being on scene, especially in those critical trauma patients. After the rapid assessment and stabilization, the focus shifts to transporting the patient to the hospital while continuing care. The remaining portion of the golden hour is used for transport and initial hospital stabilization, ensuring the patient reaches definitive care as quickly as possible. This concept highlights why EMTs must work efficiently, prioritize life threats, and minimize any unnecessary delays. Because in trauma care, every minute matters. At this point in the assessment, you should begin making decisions about patient transport. Transport decisions are based on several important factors. First and foremost, the patient's condition. Patients with life-threatening problems or unstable vital signs often require rapid transport to the closest appropriate medical facility. Another factor to consider is the availability of advanced care. Some patients may benefit from additional resources, such as ALS providers or specialized trauma centers, depending on the nature of their illness and injury. You must also consider the distance to the hospital. In some situations, it may be more appropriate to transport to the closest facility, while other cases, it might be better to travel slightly further to reach a hospital that provides more specialized care. Finally, all transport decisions must follow local protocols and our medical direction, which guide providers in choosing the most appropriate destination for the patient. By quickly considering these factors, you can ensure that patients are transported quickly to the facility best equipped to meet their needs. After completing the primary assessment and determining transport priority, we move on to history taking. History taking helps provide more detailed information about the patient's chief complaint, as well as the signs and symptoms they are experiencing. This information allows us to better understand what may be happening medically and helps guide treatment decisions. During this process, you will also gather important demographic information about the patient. This includes the date of the incident, which helps establish a timeline for the patient's condition. You should also document information such as the patient's demographics, age, gender, race, past medical history, and current health status. These details can provide valuable context and may influence how certain conditions present or how they're treated. The next step in history taking is to investigate the chief complaint, which is the primary reason they called us or requested help. When approaching a patient, it's important to begin by introducing yourself, making the patient feel as comfortable as possible, and obtaining permission to provide care whenever the patient is conscious and able to respond. Once you've established communication, begin asking some simple and direct questions to better understand what the patient is experiencing. Maintaining a professional and respectful tone is also important. A good practice is to address the patient using Mr. or Miss, followed by their last name, unless they request otherwise. You should also try to ask some open-ended questions whenever possible. These types of questions encourage patients to describe their symptoms in their own words rather than simply by answering yes or no. In some situations, the patient may be unresponsive or unable to communicate, which means you will need to gather information from other sources. When this happens, you should look for clues about the incident and the patient's medical history from the people or items around them. One valuable source of information may be family members who are present at the scene. They may be able to provide details about the patient's medical condition, medications, or even what happened leading up to the event. You may also speak to witnesses who saw the incident occur. These individuals can often provide information about details leading up to the patient's condition. Bystanders at the scene may also have useful information, especially if they're the ones who called for help. Another important clue may come from any medical alert jewelry, such as bracelets or necklaces that identify conditions like diabetes, epilepsy, or severe allergies. And finally, you should look for medical history documentation, any medication lists, or other paperwork that might provide insight into the patient's health history. Gathering information from these alternative sources helps us better understand the patient's condition when the patient is unable to communicate themselves. During history taking, EMTs often use a structured approach to better understand the patient's symptoms. One commonly used tool is the OPQRST mnemonic. This helps guide your questions so you can gather detailed information about what the patient is experiencing. The O stands for onset. This refers to when the symptoms began. You may ask the patient when the problem started or what they were doing when this first occurred. The P stands for provocation or palliation. This means identifying what makes the symptoms better or worse. For example, you might ask if movement, breathing, or certain positions affect the pain. The Q stands for quality, which describes what the symptoms feel like. For example, the patient may describe the pain as sharp, dull, crushing, burning, or pressure-like. The R stands for region or radiation. This helps determine where the symptom is located and whether it spreads to other parts of the body. The S stands for severity, which is often measured using a pain scale from 0 to 10, allowing the patient to rate the intensity of their symptoms. And finally, the T stands for time, which refers to how long the symptoms have lasted, whether they are constant or intermittent, and whether they have changed over time. In addition to OPQRST, we should also try to identify any pertinent negatives. These are symptoms that the patient does not have, which are important to ask because they help rule out certain conditions. So using OPQRST and identifying pertinent negatives helps us gather a clear and thorough understanding of the patient's symptoms. Another important part of history taking is obtaining a sample history, which helps gather key information about the patient's medical background and events surrounding the emergency. Sample is a mnemonic that helps EMTs remember the important questions to ask. The S stands for signs and symptoms. These are signs or things that you can observe, such as sweating or pale skin, while symptoms are what the patient reports feeling, such as pain or nausea. The A stands for allergies. It is important to ask the patient if they have any allergies, especially to medications, food, or environmental substances. The M stands for medications. You should ask what medications the patient currently takes, including prescription medications, over-the-counter medications or drugs, and supplements. The P is pertinent past medical history. This includes any known medical conditions, previous surgeries, or ongoing health issues that may be relevant to the current problem. The L stands for last oral intake, meaning the last time the patient ate or drank anything. This information can be especially important if the patients may require surgery or certain medical procedures. Finally, the E stands for events leading up to the illness or injury. Understanding what the patient was doing before the problem began can help us provide valuable clues about the cause of their condition. Using sample history allows us to gather important information that supports a more complete patient assessment and better treatment decisions. The final concept to discuss in this section is critical thinking in your patient assessment. As EMTs, patient care is not just about following a checklist. It also requires the ability to think critically and interpret the information you gather during your assessment. Critical thinking in EMS involves 3 key steps. The first is gathering information. This means seeking facts by observing the patient, asking questions, reviewing the scene, and collecting vital information from the patient or bystanders. The second is evaluating that information. Once you gather the facts, you must consider, what does this information mean? This involves recognizing patterns, identifying potential problems, and determining which findings are most important. The final step is synthesizing the information. This means putting all the pieces together to develop a plan for scene management and patient care. By gathering information, evaluating its meaning, and combining those findings into a clear plan, you're able to make informed decisions that lead to effective and timely patient care. Sometimes, though, during the history taking, we may need to ask questions about sensitive topics, such as alcohol or drug use. Substances like alcohol and drugs can significantly affect a patient's mental status, behavior, and physical condition, but gathering accurate information can sometimes be challenging. In these situations, the patient's signs and symptoms might be confusing, hidden, or disguised. For example, drug or alcohol use may mimic other medical conditions or mask underlying illnesses and injuries. It's also possible that a patient may deny using substances, even if there's signs that suggest otherwise. Because of this, the history that you gather may not always be completely reliable. As EMS professionals, it's essential to approach these situations with professionalism and without judgment. Focus on asking calm, respectful questions and gathering the information you need to provide the best care possible. Maintaining a professional and non-judgmental approach helps build trust and allows patients to feel more comfortable sharing important information. Another sensitive topic that we may encounter during our assessment involves physical abuse or violence, including domestic abuse. As healthcare providers, we have an important responsibility to recognize signs of possible abuse and ensure that the situation is handled appropriately. If you suspect physical or domestic violence, this incident should be reported to the appropriate authorities, following your agency's policies and local protocols. These protocols are designed to protect both the patient and the providers. It's also important to remember that EMTs should not directly accuse anyone at the scene. Instead, focus on providing care to the patient and ensuring their safety. If there are concerns about violence or abuse, law enforcement should be involved as soon as possible so the situation can be properly investigated. Another area that may come up during history taking involves sexual health history, which can sometimes be a sensitive topic for patients. In certain situations, asking these questions is important to understand the possible causes of the patient's symptoms. For example, female patients of childbearing age who report lower abdominal pain should always be considered potentially pregnant until proven otherwise. Pregnancy can affect both the diagnosis and the type of care that should be provided. Because of this, EMTs need to ask about the patient's last menstrual period, which can help determine whether pregnancy may be a factor in the patient's condition. With male patients, it may also be appropriate to ask about urinary symptoms, such as pain during urination or difficulty urinating, which can provide clues about infections and other medical conditions. In some situations, it may be also appropriate to ask about the possibility of sexually transmitted diseases, especially if the symptoms suggest an infection. As with all sensitive topics, these questions should be asked professionally, respectfully, and with discretion, ensuring the patient feels comfortable and understands that the purpose of the questions is to provide the best medical care possible. Obtaining a patient history is not always straightforward. We may face several special challenges when trying to gather information, and one of these challenges can be silence. Sometimes a patient might not respond right away, or maybe they're hesitant to speak. In these situations, patience is really important. Our patients may be scared, confused, in pain, or unsure about what is happening. If the patient is having difficulty answering open-ended questions, it might help to switch to closed-ended questions that require a simple yes or no response. This can make communication easier for patients who are weak or anxious or having trouble speaking. It's also important to consider that the patient's silence might be a clue about their condition. For example, a patient who can't speak due to severe shortness of breath or altered mental status, or even have a neurologic problem, they may have difficulty just responding. By remaining calm and patient and observant, we can still gather valuable information even when the communication is limited or difficult. Another challenge we may face is overly talkative patients. Some patients might talk continuously and provide large amounts of information that may or may not be relevant to their chief complaint. While communication is important, too much information can sometimes make it difficult to quickly identify what is medically important. There are several reasons why a patient may appear overly talkative: excessive caffeine consumption, nervousness or anxiety, and in some cases, drug use can stimulate the nervous system and lead to rapid or excessive speech. There may be an underlying physiological condition affecting the patient's behavior. As EMTs, it's important to remain professional and respectful while guiding the conversation back to the chief complaint and any relevant medical information. This helps you guide the information you need while still allowing the patient to feel heard. Another challenge when obtaining a physical history is when the patient reports multiple symptoms. Patients will sometimes describe several problems at once, and it might not be immediately clear which of these is the most important or which symptoms started first. In these situations, you should approach the situation similarly to triage. This means prioritizing the patient's complaint based on which symptoms are the most serious or potentially life-threatening. Start by addressing the most concerning or severe symptoms first, such as chest pain or difficulty breathing or maybe altered mental status. Once those have been evaluated, you can move on to the less serious complaints. Another challenge you may encounter when obtaining a patient's history is anxiety. Many patients are understandably anxious during a medical emergency. Anxiety can sometimes cause symptoms that resemble other medical conditions, which can make assessments more challenging. Some anxious patients may show signs that look similar to physiologic shock. This can include pallor, which means pale skin, diaphoresis, or shortness of breath. They may also report numbness or tingling in their hands and feet, dizziness, lightheadedness, and even in some cases experience a loss of consciousness. As EMTs, it's important to recognize that anxiety can produce very real physical symptoms. Remaining calm, reassuring, and professional can help reduce the patient's anxiety and improve communication while continuing your assessment. Another challenge we may encounter is anger or hostility. In emergency situations, emotions can run really high. Friends, family, or bystanders may feel scared or overwhelmed, frustrated, and sometimes these emotions can be directed towards us. When this happens, it's important to remain calm, reassuring, and professional. Your tone and demeanor can often help de-escalate a tense situation. However, scene safety always comes first. If the environment becomes unsafe or hostile, the priority is to ensure the scene is properly secured before continuing patient care. This may involve requesting law enforcement if needed. Another challenge we may encounter is obtaining a patient history when the patient is intoxicated. Patients who are under the influence of alcohol or drugs may have impaired judgment, slowed thinking, or difficulty communicating. Because of this, the information they provide may sometimes be incomplete or unreliable. It's also important to remember that intoxicated patients may misinterpret our actions or feel easily threatened. So we should avoid putting them in situations where they may feel concerned or confronted. There's also higher potential for violence and physical confrontation in these situations. So maintaining scene safety and awareness is extremely important. Additionally, alcohol can dull a patient's senses, meaning they may not fully recognize injuries, pain, or medical problems. Another challenge we may face is a crying patient. Patients may cry for a variety of reasons. They may be in pain, frightened, overwhelmed, or emotionally distressed by what is happening. In an emergency situation, these reactions are completely normal. When encountering a patient who's crying, it's important for EMTs to remain calm and composed. Be patient, reassuring, and confident while speaking with the patient. Sometimes simply allowing the patient a moment to collect themselves can help them regain enough control to answer questions. Another challenge we may encounter is depression. Depression is actually one of the leading causes of disability worldwide. It can affect a patient's ability or willingness to communicate during an emergency. Patients experiencing depression may show signs of sadness, feelings of hopelessness, restlessness, changes in sleep pattern and appetite, and decreased energy levels. Because of these symptoms, patients may appear withdrawn, speak very little, or seem uninterested in answering questions. In these situations, one of the most important things we can do is be a good listener. Showing patience, respect, and empathy can help the patient feel more comfortable and may encourage them to share important information about their condition. Another challenge we may face is confusing behavior or unclear history. Sometimes a patient may provide information that doesn't seem to make sense or changes over time. This can happen because of certain medical conditions affecting their thinking, memory, or ability to communicate. For example, conditions such as hypoxia, stroke, diabetes, head trauma, medications, or drug use can all alter the patient's mental status and affect how they explain what happened. In older patients, confusion may also be related to dementia, delirium, or Alzheimer's disease. When this happens, you should recognize that the patient may not be able to provide reliable information. In those situations, it becomes important to gather information from family members, caregivers, bystanders, or any medical documentation if possible. Another challenge we may encounter is limited cognitive ability. Some patients have limited or difficulty understanding questions and explaining their symptoms. This can occur in young children, patients with developmental disabilities, elderly patients with dementia, or just patients with altered mental status. In these situations, it's important to keep your questions clear and simple and avoid using complex medical terminology which may confuse them. When available, family members, caregivers, or friends can often provide helpful information about the patient's medical history, medications, or what happened prior to our arrival. Another challenge when obtaining a history involves cultural challenges or differences. Patients from different cultural backgrounds may have different expectations, beliefs, or comfort levels when interacting with healthcare providers. One important guideline is to avoid using complicated medical language. Use simple, clear explanations that are easy for patients to understand. In some cultures, patients may feel more comfortable speaking with a provider of the same gender, especially when discussing personal or sensitive health issues. Family members or friends may also play an important role in communication and decision making. In these situations, it may be helpful to gain their assistance when appropriate to better understand the patient's concerns. Being respectful and culturally aware helps us provide more effective and compassionate patient care. Another challenge we may face when obtaining a history is language barriers. If the patient speaks a different language, the best option, when available, is to find an interpreter who can help ensure clear and accurate communication. If an interpreter is not immediately available, you should first determine whether the patient understands who you are and why you are there. Establishing basic understanding is an important first step. When communicating across a language barrier, try to keep your questions simple, straightforward, and brief. Avoid complicated explanations and medical terminology. You can also use hand gestures or pointing to help communicate basic ideas or questions. It's also helpful to be aware of the language diversity within your community, so you can better anticipate communication challenges and know what resources may be available to assist. Another challenge we may face is hearing problems. Some patients may have partial or complete hearing loss, which can make communication more difficult during an assessment. When speaking with a patient who may have hearing difficulty, it's important to ask questions slowly and clearly. Speaking at a normal volume while clearly enunciating words can help the patient better understand you. One technique sometimes used in EMS is to place the stethoscope earpieces in the patient's ears and speak into the diaphragm, which can help amplify your voice and act somewhat like a hearing aid. Learning some basic sign language gestures can often be helpful in certain situations and may improve communication. Another simple and effective option is to use pencil and paper to write questions down or allow the patient to write their responses. The goal is to adapt your communication so you can still gather important information and provide appropriate care. Visual impairments. Patients who are blind or have limited vision rely heavily on verbal communication and awareness of their surroundings. When approaching a patient with a visual impairment, it's important to identify yourself verbally as soon as you enter the scene. Let the patient know who you are and why you are there so they understand what is happening. If you move any items around the patient while providing care, try to return those items to their original positions. This helps the patient maintain familiarity with the environment. It's also important to explain what you're doing during each step of the assessment, especially when we're checking vital signs or doing procedures. This helps the patient feel more comfortable and reduces anxiety. After completing the primary assessment and addressing any life threats, you may perform a secondary assessment. This may be performed on scene, in the back of the ambulance during transport, or in some situations, maybe not at all, depending on the patient's condition and transport priority. The purpose of the secondary assessment is to perform a more systematic physical exam of the patient to identify injuries or medical problems that were not immediately life threats during the primary assessment. This exam may involve a full head-to-toe assessment where the EMT evaluates the entire body for injuries or abnormalities. In other situations, the secondary assessment may be focused on a specific area or body system, especially if the patient's chief complaint points to a particular problem. The goal of the secondary assessment is to gather information that helps guide patient care and treatment decisions. During the secondary assessment, we use several basic examination techniques to evaluate the patient. The first is inspection, which simply means looking carefully at the patient for any abnormalities. This can include things like deformities, swelling, discoloration, bleeding, or unusual movement. The second technique is palpation. This involves touching or feeling the patient to check for abnormalities such as tenderness, deformities, swelling, or unusual warmth or coolness. The third technique is auscultation, which means listening to the sounds inside the body using a stethoscope. This may include listening to lung sounds, heart sounds, bowel sounds, depending on the situation. These three techniques help gather important physical findings and guide assessment and treatment. During the secondary assessment, we might use mnemonics. The DCAP BTLS mnemonic stands for deformities, contusions, abrasions, punctures and penetrations, burns, tenderness, lacerations, and swelling. As you examine each area of the patient's body, you're looking and feeling for any of these signs of injury. This mnemonic helps ensure that you perform a thorough and consistent physical exam during your head-to-toe assessment. Another important principle during the exam is to compare one side of the body to the other whenever possible. The human body is generally symmetrical, so differences between left and right can often indicate injuries or abnormal findings. Using structured tools like the DCAP BTLS mnemonic helps you stay organized and ensures that important findings are not missed during your assessment. The secondary assessment is a systematic evaluation of the patient performed after life threats have been identified and managed. The goal of this assessment is to identify hidden injuries or medical problems that may not have been discovered during that 60 to 90-second primary assessment. During the primary assessment, we focused on those life threats, such as airway, breathing, bleeding, and shock. Because that assessment happens quickly, some injuries or conditions may not be immediately obvious. So the secondary assessment allows us to slow down and examine the patient more thoroughly, helping to uncover additional injuries or medical problems that might still require our attention. Another type of secondary assessment is the focused assessment. This type of exam is typically performed on patients who have experienced a non-significant mechanism injury or responsive medical patients who appear stable. Instead of examining the entire body from head to toe, a focused assessment is based on their chief complaint. We concentrate on a specific body system or body part related to their symptoms. So, for example, a patient that's complaining of ankle pain after a fall may only require an assessment of the ankle and the surrounding structures, where a patient with shortness of breath may require a focused respiratory exam. The goal of the focused assessment is to direct your attention to the areas most likely to be affected, allowing you to quickly identify the problem and provide appropriate care. During the focused assessment, we often evaluate specific body symptoms based on the patient's complaint. One important system to assess is the respiratory system. When assessing the respiratory system, the first step is to expose the patient's chest if possible so you can properly observe breathing. Next, look for signs of airway obstruction, such as abnormal sounds, difficulty speaking, or visible obstructions. You should also inspect the chest for symmetry, meaning both sides of the chest should rise and fall evenly during breathing. Unequal movement may indicate an injury or respiratory problem. Listen carefully to your patient's breath sounds, either with a stethoscope or by closely observing their breathing. You should also measure their respiratory rate, noting whether breathing is slow, normal, or rapid. Finally, looking for signs of increased work of breathing, such as retractions of the muscles between the ribs, use of accessory muscles, or labored breathing. All of these observations help determine whether the patient is breathing effectively and getting enough oxygen. When assessing the respiratory system, one important vital sign to measure is the respiratory rate. Children, however, normally breathe faster than an adult, so their expected respiratory rates will be higher depending on their age. To measure a patient's respiratory rate, observe the rise and fall of the chest and count the number of breaths in the 30-second period. Then multiply that number by 2 to determine the breaths per minute. While counting respirations, it's also helpful to observe the depth and effort of breathing, as well as whether the breathing pattern appears normal or abnormal. Monitoring respiratory rate gives EMTs important information about how well the patient's lungs and body are functioning. Another important part of assessing breathing is evaluating the respiratory rhythm, Respiratory rhythm refers to the pattern and regularity of the patient's breathing. A regular respiratory rhythm means the time between each breath, or the time from one peak chest rise to the next, is fairly consistent and predictable. An irregular respiratory rhythm, on the other hand, means the respirations vary in timing or the breathing rate changes frequently. Irregular breathing patterns can sometimes indicate serious medical conditions, such as head injuries, neurologic problems, or respiratory distress. By observing not only the rate of breathing, but also the rhythm and pattern, EMTs can gain important clues about the patient's overall respiratory status. Another important part of assessing the respiratory system is the quality of breathing. Normal breathing is typically quiet and effortless. You should not hear significant sounds when a patient is breathing normally. However, if breathing is accompanied by abnormal sounds, it may indicate a significant respiratory problem. These sounds could include things like wheezing or stridor, gurgling, or snoring, which may suggest airway obstruction, fluid in the airway, or narrowing of the airways. When assessing breathing quality, EMTs should not only pay attention to how fast the patient is breathing, but how the breathing sounds and how much effort it requires. Another important aspect of assessing the respiratory system is evaluating depth of breathing. Depth of breathing refers to how much air the patient moves in and out of the lungs with each breath. The total amount of air exchanged depends on the respiratory rate and the tidal volume, which is the amount of air moved with each breath. Patients may have shallow breathing, where only a small amount of air is exchanged, or deep breathing, where larger volumes of air move in and out of the lungs. EMTs should also listen carefully to the patient's breath sounds using a stethoscope. Breath sounds can provide important clues about the condition of the lungs and airways. In many cases, breath sounds are easier to hear from the patient's back because the lungs set closer to the back of the chest. Listening to several locations on both sides of the chest can help identify abnormal or unequal breath sounds. When listening to breath sounds, it's important to place the stethoscope in several different locations on the chest. As shown here, we should listen to both sides of the chest and multiple lung fields. This allows us to compare breath sounds from left to right and identify any differences. The first image shows proper placement of the stethoscope on the front of the chest, where you can listen to breath sounds in the upper lung fields. The second image demonstrates listening to breath sounds from the patient's back, which often allows you to hear lung sounds more clearly. When auscultating breath sounds, listen for whether the sounds are clear and equal on both sides and present in all areas. Comparing multiple areas of the chest helps us detect abnormalities such as decreased breath sounds, wheezing, crackles, or absent breath sounds, which may indicate underlying problems. When listening to patients' lung sounds, you should be paying close attention to the type of sounds you hear. The first is normal breath sounds, which are typically quiet and smooth, indicating that air is moving normally through the lungs. You may also hear snoring breath sounds, which usually suggests a partial airway obstruction, often caused by the tongue or soft tissue blocking the airway in our unconscious patients. Another abnormal sound is wheezing. This is a high-pitched sound often heard when the airways are narrowed, such as asthma or some other respiratory conditions. You may also hear crackles, which are popping and crackling sounds that can indicate fluid in the lungs, commonly seen in conditions like pneumonia and pulmonary edema. Rhonchi are lower-pitched, rattling sounds that may indicate mucus or secretions in the larger airways. And finally, stridor is a harsh, high-pitched sound heard during breathing that often indicates severe upper airway obstruction and requires immediate attention. Recognizing these different breath sounds helps us quickly identify potential respiratory problems and determine appropriate treatments. Another important system to assess during a focused assessment is the cardiovascular system. When evaluating this system, we should first look for any signs of trauma to the chest, which could affect the heart or major blood vessels. While doing this, continue to listen to breath sounds, since chest injuries can also impact breathing. You should consider several important vital signs, including the patient's pulse, respiratory rate, and blood pressure. These measurements help determine how well the heart and the circulatory system are functioning. When assessing the pulse specifically, pay close attention to the rate, quality, and rhythm. The rate refers to how fast the heart is beating. The quality refers to how strong or weak the pulse feels, and the rhythm refers to whether the heartbeat is regular or irregular. Together, these findings provide valuable information about how well the patient's heart and circulatory system are working. We should also consider several other findings. First, think back to what you observed when assessing the patient's skin. Skin color, temperature, and moisture can provide important clues about circulation and perfusion. We should also check distal pulses, such as the pulses in the feet or the wrist, and compare them on both sides of the body. Differences between left and right may indicate a circulatory problem or possible injury. In some situations, we may also auscultate or listen for abnormal heart sounds using a stethoscope. Although this is more commonly done at higher levels of care, it can sometimes provide additional information about the patient's cardiovascular status. Together, these observations help us better understand how effectively the heart and circulatory system are delivering blood throughout the body. Another key part of the cardiovascular assessment is the pulse rate. In most adults, a resting pulse is typically between 60 and 100 beats per minute. However, pulse rates are going to vary by age, and in general, younger patients have faster pulse rates than adults. Infants and toddlers may normally have a much higher pulse rate because their heart beats faster to meet their metabolic demands. As patients get older, the normal pulse range gradually slows down towards the adult range. When checking a patient's pulse, we should not only consider the rate, but the strength and regularity of the pulse. Understanding normal pulse ranges for different age groups helps us recognize when the pulse may be too fast, too slow, or abnormal, which can indicate underlying medical problems. Another important part of evaluating the cardiovascular system is assessing the quality. Pulse quality refers to how strong or weak the pulse feels when you palpate it. If the pulse feels stronger than normal, it's often described as bounding. This means it feels very strong and forceful under your fingers. On the other hand, if the pulse feels weak or difficult to feel, it might be described as weak or thready. The thready pulse can sometimes indicate poor circulation, shock, or low blood pressure. Assessing a pulse quality helps us understand how effectively the heart is pumping blood throughout the body and whether the patient may be experiencing problems with circulation. Another important part is the pulse rhythm. The rhythm refers to the pattern of the heartbeat and whether the beat occurs at consistent intervals. A regular pulse rhythm means the time between each heartbeat is even and consistent, and the pulse occurs in a steady, predictable pattern. An irregular pulse rate means the beats do not occur at consistent intervals. This could happen if the heart occasionally has a beat that comes earlier or later than expected, or if a beat is just skipped altogether. Irregular pulse rhythms can sometimes indicate underlying cardiac problems, so it's important to recognize when a pulse is not following a normal pattern. And by assessing the rate, quality, and rhythm of the pulse, we gain valuable insight into the patient's cardiovascular status. Another key thing in the cardiovascular system is measuring the blood pressure. This refers to the force of circulating blood pushing against the walls of the arteries as the heart pumps blood through the body. A patient's blood pressure can provide important clues about how well the circulatory system is functioning. A drop in blood pressure, also known as hypotension, may indicate several possible problems. One possibility is a loss of blood or body fluids, which can occur with bleeding, dehydration, or severe illness. Low blood pressure may also be the result of a loss of vascular tone, meaning the blood vessels are not constricting properly to maintain circulation. Finally, a drop in blood pressure may indicate a problem with the heart's ability to pump effectively, which can occur in certain cardiac conditions. Monitoring blood pressure helps evaluate whether a patient is maintaining adequate circulation and perfusion. This slide continues our discussion of blood pressure and what abnormal values may indicate. A decrease in blood pressure is often considered a late sign of shock. This means that by the time a patient's blood pressure begins to drop, the body is probably already struggling to maintain adequate circulation for some time. Because of this, we should look for earlier signs of shock, such as changes in mental status, skin condition, and pulse quality. On the other hand, abnormally high blood pressure, also known as hypertension, can also be dangerous. extremely high blood pressure can place significant stress on the arterial system, potentially leading to ruptures or other critical damage to blood vessels. Monitoring blood pressure helps recognize both poor circulation and dangerous increases in vascular pressure. To measure blood pressure, EMTs use a blood pressure cuff with a gauge, also known as a sphygmometer. This is made up of several important components. First, there's a wide outer cuff which wraps around the patient's arm. Inside the cuff is an inflatable bladder. When air is pumped into this bladder, it tightens around the arm and temporarily compresses the artery so blood flow can be measured. The cuff is inflated using a ball pump, which is the one-way valve that allows air to enter the cuff while preventing it from escaping until the valve is released. Finally, the device includes a pressure gauge, which allows us to read the pressure inside the cuff and determine the patient's blood pressure. Understanding the parts of the blood pressure cuff help us correctly operate it and obtain accurate blood pressure readings during our assessment. Blood pressure can be measured in two main methods, auscultation and palpation. Auscultation is the most commonly used technique. With this method, we place the blood pressure cuff on the patient's arm and use a stethoscope to listen to the blood flow through the artery, while slowly releasing air from the cuff. The sounds heard through the stethoscope help determine the patient's systolic and diastolic blood pressure. The palpation method is another technique that may be used when it's difficult to hear with a stethoscope, such as in a noisy environment or if the patient's moving a lot. This method relies on feeling the pulse rather than listening for sounds. Before applying the blood pressure cuff, EMTs should follow standard precautions and check the patient's arms for conditions that may prevent us from using that arm. For example, avoid using an arm with a dialysis fistula, a central line, or any kind of recent injury, or a history of a mastectomy. If any of these are present, use the other arm if possible. The cuff should be applied snugly around the upper arm, with the lower edge of the cuff placed about 1 inch above the antecubital space, which is the bend of the elbow. This slide shows normal ranges of blood pressures for different age groups. For most adults, the normal systolic blood pressure ranges from about 90 to 120 millimeters of mercury. As with pulse and respiratory rate, normal blood pressure varies by age. Children, infants, and newborns typically have lower normal blood pressure ranges than adults because their cardiovascular systems are still developing. When evaluating blood pressure, we should also understand two important terms: hypotension, which refers to blood pressure that's lower than normal, and hypertension, which refers to blood pressure that's higher than normal. Over time, high blood pressure can place stress on the heart and blood vessels, increasing the risk for serious problems. Another important system to assess is the neurologic system. A neurologic assessment should be performed whenever a patient shows signs that their brain or nervous system might be affected. This includes patients who have changes in mental status, meaning they're confused, disoriented, or not behaving normally. A neurologic assessment is also important if the patient has experienced a possible head injury, since trauma can affect brain function. In other situations that may require a neurologic assessment, some of these cases may be stupor, which is a reduced level of responsiveness, or dizziness and drowsiness, which may indicate problems with brain function and circulation. Another important symptom is syncope, which refers to fainting or a temporary loss of consciousness. Performing a neurologic assessment helps us evaluate how well the brain and nervous system are functioning and determine whether there's a serious underlying condition possibly occurring. This slide continues the discussion with the neurologic assessment. One of the most important things that we evaluate is the patient's level of consciousness and orientation. A quick and commonly used tool for this is the AVPU scale, which stands for alert, responsive to verbal stimuli, responsive to pain, and unresponsive. This scale allows us to rapidly assess their responsiveness during a primary or a secondary assessment. And in some situations, especially with head injuries and altered mental status, using the Glasgow Coma Scale or a GCS may also be important. The GCS provides more detailed neurologic assessment by evaluating eye opening, verbal response, and motor response, which together produce a score that helps determine the severity of the neurologic impairment. Another part of the neuro assessment is the patient's pupils. The pupil is the black center portion of the eye that allows light to enter. Pupils help control how much light reaches the back of the eye. Under normal conditions, pupils are round and approximately equal in size. Pupils also respond to light. When light is present, the pupils constrict or get smaller. When there's little or no light, the pupils relax and dilate, meaning they become larger. Observing the size, shape, and reaction to light from the pupils can give us important clues about a patient's neurologic status or potential for head injury. Here are some different examples of pupil findings that you may see during a neurologic assessment. The image A, the pupils are constricted, meaning they're very small. Constricted pupils can be seen sometimes with certain medications, use of opioids, and exposure to bright light. In image B, the pupils are dilated, meaning larger than normal. Dilated pupils may occur in low light conditions, but they can also be associated with head injuries, drug use, and other neuro problems. In image C, the pupils are unequal in size. Unequal pupils can be very important finding and may indicate a serious neurologic issue, such as increased intracranial pressure or head trauma. When assessing pupils, we should check size, equality, and reaction to light, and document whether the pupils are equal, round, and reactive to light or not. While unequal pupils can sometimes be a sign of a serious problem, it's important to know that a small percentage of the population naturally has unequal pupils. In those cases, the difference is normal for that patient and may not indicate an emergency. However, unequal pupils can be also associated with depressed brain function, which is why the finding should be taken seriously during an assessment. Some possible causes might be an injury to the brain or brainstem, trauma or stroke, or even a brain tumor. Pupillary changes can occur when the brain is not receiving enough oxygen or blood flow, which we refer to as inadequate oxygenation or perfusion. And finally, certain drugs or toxins can affect the pupils and how they react to light. To help guide your assessment, we also often use the mnemonic PEARRL. This stands for pupils equal and round, regular in size, reactive to light. When you assess a patient's pupils, you're looking to see that both pupils are the same size, that they're round, they constrict appropriately when exposed to light, and if the pupils are unequal, irregularly shaped, fixed, or slow to react to light, this can indicate a possible neurologic problem, a head injury, or other medical condition. As part of your neuro assessment, always remember to observe the pupils carefully and document any findings clearly. Another important part of the neuro exam is assessing the patient's neurovascular status. This involves checking muscular strength and weakness on both sides of the body. One of the key things we're looking for is symmetry. If one side of the body is noticeably weaker than the other, this could indicate a neurologic problem such as a stroke or nerve injury. You should also complete a sensory assessment by evaluating the patient's ability to feel different sensations. This can include checking for pain, touch, or position sense. As you perform these checks, compare responses from one side of the body to the other, and also compare distal areas like the hands and feet with more proximal areas like the arms and legs. During the secondary assessment, we evaluate the body systematically by anatomic regions, beginning with the head, neck, and C-spine. Start by palpating the scalp and skull, feeling for any deformities, tenderness, swelling, and depressions that could indicate trauma. Next, check the patient's eyes. Look for equal pupils, abnormal eye movement, or signs of injury. Also observe the color of the sclera, which is the white part of the eye. Changes in color, such as yellowing or redness, can sometimes indicate underlying medical issues. You should also check the patient's cheekbones for tenderness, deformity, or instability, which could suggest facial fractures. Finally, check the ears and nose for any fluid, particularly clear fluid or blood. This could indicate a possible skull fracture or head injury and should always be taken seriously. As always, remember to look, listen, and feel carefully while comparing both sides of the body. Continuing to the head, neck, and C-spine, you should also evaluate the patient's jaw and mouth. Start by checking the upper jaw, called the maxilla, and the lower jaw, known as the mandible. Look and gently palpate for pain, instability, and deformity that could suggest a fracture or injury. Next, open the patient's mouth and check for broken, loose, or missing teeth. This is especially important in trauma patients because teeth can become aspiration hazards if they're loose or dislodged. When examining the mouth, look for any unusual odors. Certain smells can provide clues about the patient's condition. For example, a fruity odor may suggest diabetic ketoacidosis, while a smell of alcohol or chemicals might indicate intoxication or poisoning. Next, during the secondary assessment, we examine the chest. Start by inspecting, visualizing, and palpating the chest. Look carefully at the chest wall for any injuries, deformities, bruising, or penetrating trauma. Watching the patient's breathing and make sure that both sides of the chest rise and fall during normal respirations. Equal chest movement is an important sign that both lungs are expanding properly. Next is the abdomen during our secondary assessment. Begin by palpating the abdomen to check for tenderness, rigidity, or guarding. Tenderness might indicate injury or illness, while rigidity or guarding can suggest internal irritation, inflammation, or bleeding. When evaluating the abdomen, we divide it into 4 quadrants to help identify where pain or problems are located. Using these quadrants allows us to more accurately describe findings and communicate patient information to other healthcare providers. Next, we assess the pelvis and the extremities. When evaluating the pelvis, begin by inspecting for symmetry and looking for any obvious signs of injury, bleeding, or deformity. Pelvic injuries can be serious because they may involve significant internal bleeding, so carefully observing this area is important. Next, examine the patient's extremities, which include the arms and the legs. Remember, compare one side of the body to the other, left to right, and document any abnormalities you find. Finally, assess the posterior portion of the body, which includes the patient's back and spine. To properly examine the back, the patient may need to be carefully log rolled while maintaining spinal precautions, especially if trauma is suspected. Inspect the entire back for signs of DCAP BTLS, which stands again for deformities, contusions, abrasions, punctures or penetrations, burns, tenderness, lacerations, and swelling. Next, palpate the spine from the neck down to the pelvis, feeling carefully for tenderness, step-off, or deformities, which could indicate a possible spinal injury. Assessing the posterior body helps ensure that no injuries are missed, especially those that might not be visible from the front during our initial assessment. Another important part of the patient assessment is vital signs. In addition to manual assessment techniques, we often use monitoring devices to gather additional information about the patient's condition. However, it's important to remember these devices should never replace our overall patient assessment. They're important tools to support our findings, but not a substitute for them. One common monitoring tool is the pulse ox. This device is placed on a finger and measures the percentage of oxygen saturation in the patient's blood. Pulse oximetry helps us evaluate how effectively oxygen is being delivered throughout the body. Low oxygen saturations may indicate problems with breathing, circulation, or oxygenation, and can further guide our treatment decisions. It's important to understand exactly what the pulse oximetry is measuring. For example, if a patient shows signs of difficulty breathing, they should receive oxygen therapy regardless of what the pulse oximeter reading shows. This highlights an important principle in EMS. Treat the patient, not just the number. Monitoring devices are helpful, but our assessment and clinical judgment are always the most important factors in our patient care. Additional tools may also be used to assess the patient's vitals and overall condition. One of these tools is capnography. Capnography measures the amount of carbon dioxide in the patient's exhaled breath. This can provide quick and valuable information about a patient's ventilation, circulation, and metabolic status. It's particularly helpful for monitoring patients with respiratory problems and those who are receiving advanced airway management. Another important assessment tool is blood glucometry, which measures the level of glucose in the bloodstream. Checking a patient's blood glucose level is really important if the patient has altered mental status, weakness, dizziness, or other signs of a possible diabetic complication. Abnormal glucose levels, either too high or too low, can significantly affect a patient's condition and may require immediate treatment. These tools provide additional data that help guide our patient care, but should always be used alongside a thorough physical assessment and getting a patient history. The final vital sign measurement we'll discuss is non-invasive blood pressure monitoring. Blood pressure is typically measured by that device we just talked about called the sphygmometer, which includes a cuff, a bladder, a bulb for inflation, and a pressure gauge. Blood pressure provides important information about how effectively the heart is pumping and how well blood is circulating through the body. After the initial assessments are completed, it's important to continue with reassessment and thorough patient care. Reassessment should be performed at regular intervals while you are monitoring and treating a patient. This helps identify changes in their condition, whether they're improving or deteriorating. During reassessment, we should repeat our primary assessment, making sure that the patient's airway, breathing, and circulation status remains stable. We should also reassess vital signs and compare them to the baseline vital signs that we obtained early in the primary assessment. This allows us to identify trends over time, which can provide important clues about the patient's condition. Recognizing trends rather than focusing on a single set of numbers helps guide our treatment decisions and ensures the patients receive the most appropriate care. During reassessment, it's also important to revisit the patient's chief complaint. You should continually ask yourself whether the current treatment is improving the patient's condition. For example, if oxygen, medication, or positioning of the patient has been provided, you should evaluate whether the patient's responding positively. You should also consider whether any identified problems have improved or worsened since our initial assessment. A patient's condition can change quickly, and reassessment helps recognize those changes early. Another key part of reassessment is rechecking your interventions. As patient care continues, you should review all treatments and interventions that have been provided to ensure that they're appropriate and still working as intended. The most important thing to reassess is the ABCs: airway, breathing, and circulation. Make sure the airway remains open, breathing is adequate, and circulation is sufficient. You should also confirm that any bleeding is still properly controlled and that bandages, splints, or other treatments remain effective. Finally, consider whether additional interventions may now be needed based on a patient's current condition. Rechecking interventions help ensure that the care that you've provided continues to support the patient's needs as their conditions change. The final step in the ongoing assessment is to continue to identify and treat any changes in their patient condition. As you reassess the patient, it's important to document any changes observed, whether the patient's improving or deteriorating. Accurate documentation helps ensure clear communication with other healthcare providers. Reassessment should occur at regular intervals depending on the patient's condition. For unstable patients, reassessment typically occurs about every 5 minutes, since their conditions can change rapidly. For our stable patients, reassessment's usually performed about every 15 minutes. This ongoing monitoring allows us to quickly recognize changes, adjust our treatments if necessary, and ensure the patient continues to receive appropriate care throughout the transport and transfer of care. Patient assessment is one of the most important skills that you're going to develop. By systematically gathering information throughout the primary assessment, history taking, secondary assessment, vital signs, and ongoing reassessment, you can quickly identify life-threatening problems and guide appropriate treatment. Using tools such as sample and OPQRST, evaluating body systems, and carefully monitoring vital signs helps build a clear picture of our patient's condition. Just as important is the ability to continuously reassess the patient, recognize trends, and respond to any changes that may occur. A thorough and organized assessment helps to ensure that no critical findings are missed, supports sound clinical decision-making, and improves communication with other healthcare providers. Ultimately, effective patient assessment allows us to prioritize care, provide appropriate interventions, and deliver the safest and most effective treatment possible for every patient encounter.